Contract negotiation period. Contract negotiation period is when both sides appoint spokespeople and good faith bargaining is mandated. There are certain mandatory subjects of bargaining. During contract negotiation period, an arbitrator, which is a neutral party whose purpose is to be fair to both sides, may be necessary. If both sides cannot agree, work stoppages by employees and lockouts by management can occur. Once a contract is ratified, collective bargaining does not end but enters the enforcement stage. To prevent unionization typically formed when there are disagreements with management, it's suggested that management provide opportunity for decision-making, maintain fair salaries, value and trust workers, and develop a grievance procedure, and survey staff's feelings and views. After a contract is accepted, nurses should know and understand contract provisions and treat all persons being supervised with equal respect and behave professionally. Case law in the National Labor Relations Act. The Sixth Circuit Court held that staff nurses, including LPNs, at a nursing facility were supervisors under the definition of the NLRB and therefore were not entitled to the Act's protection. Court cases continue to confuse the issue regarding the status of nurses as supervisors or non-supervisors. I mean, if you're a supervisor, that technically can push you out of union's protection. So the Family and Medical Leave Act, and I just have to give a shout out. There is a woman, the woman who helps solidify the passing of the FMLA Act of 1993. Her name is Pat Schroeder. She's still alive. She was one of the first women. I feel like she was like the 10th woman in Congress or something like really crazy like that. But she represented Colorado and she helped pass the FMLA Act. So FMLA attempts to balance the demands of workplace with demands of family and allows an employed individual to take leave for medical reasons like birth of child, provide job security, and it's gender neutral. Workers' compensation is a form of insurance that provides compensation for medical care when employees are injured during the course and scope of their employment. In exchange, the employee forfeits the right to sue the employer for negligence. I think workers' comp is important for sure. I will say that this definitely was super important when there were caps on your health insurance as well. I mean, this is still important because workers' comp, you also have to think about like long-term payments for things. But here's a really good example. So the Affordable Care Act protected people from lifetime caps from their insurance policy. So meaning like once they hit a certain number, they were no longer covered under a certain diagnosis. So say you got hurt on the job and you slipped 3 discs and you're young, so you're 32 or something like that. If you hit your lifetime cap under that diagnosis and say, you know, by the time you're 60, you need another surgery, you will have to pay for that out of pocket. Workers' comp protected you against that. In addition, it also protected people against, you know, if they had high deductibles when the year turned over and for frequent treatment. But the turnaround is that you could not go back and sue them for negligence. Patient Protection and Affordable Care Act, the PPACA, provides for the phased implementation over 4 years of a comprehensive system of mandated health insurance. It includes eliminating precondition screenings and premium loading fees and structures. So this is when I talked about that lifetime cap. It includes policy cancellation when illnesses appear imminent and annual and lifetime coverage gaps. So one thing that's important is that policies used to be able to cancel whenever. And so if they read the writing on the wall, so for example, they noticed that you were getting like a ton of MRIs and PET scans and all that stuff and kind of were like, oh boy, it sounds like, or like biopsies. sounds like this person is clearly about to get themselves a diagnosis of cancer. They could drop you without any recourse. And now you're protected against that. So that's part of the Affordable Care Act. It's called the Patient Protection and Affordable Care Act. The other slang term for Affordable Care Act is Obamacare. So these are parts of the Affordable Care Act that very rarely get talked about during policy, but they're really quite nice. So I'll tell you a little story about annual and lifetime coverage gaps. So you have a child who gets a heart transplant at age 8. Heart transplants are obviously a lifetime maintenance. The rejection drugs alone are $4,000 a month and are lifetime. It used to be that insurances had $150,000 lifetime caps, including for minors. And then once they hit that, they were no longer covered, and you would have to pay out of pocket. In addition, once that minor became an adult and they got a job and got new coverage, their pre-existing condition could either preclude them from coverage or preclude that diagnosis from coverage. So then they would have to pay out of pocket for that diagnosis. So the Healthcare and Education Reconciliation Act, it was enacted to amend the earlier act as it related to the federal budget and deficit, increases tax credit to buy insurance, lowers penalties for not buying insurance, requires physicians who treat Medicare patients to be reimbursed at a full rate of payment. So effects of reform, nursing facilities would be required to have compliance and ethics training program, and it provided a greater opportunity for advanced practice nurses due to greater demand of nursing generalists. Pre-existing conditions will demand that nurses have in-depth knowledge of illness, and then patient education will be enhanced. So ethical issues, procedures for restraining and testing employees suspected of substance abuse, persistence of discrimination in the workplace, and then employment at will and the ability of employers to dismiss employees for cause or no cause. So when you work in an at-will state, you technically don't have to have any reason to be dismissed unless you work for a place that has a union. So that's really tough too. Being mindful of patients' dependency on nurses for movement and not to give preference to more easily moved patients. So now we're going to jump into Chapter 14, which talks about the Americans with Disabilities Act and the Civil Rights Act. So the ADA, the American Disabilities Act of 1990, was created to provide comprehensive protections to Americans with disabilities. It combined two legal concepts of disability and equality. The act necessitated by the discrimination faced by individuals with HIV and AIDS. So when HIV and AIDS hit its fever pitch, it was still so unknown about the cause and the spread, or there was still, I don't know necessarily about unknown, but people were ignorant in it, and people were being fired for no apparent reason. And also, for example, say you had AIDS and due to a symptom, something happened, like you had to leave in the middle of the meeting, and then they fired you for that. You actually could be protected under the ADA. So definition of disability, it was clarified and reiterated in 2008. Who's covered by the law of civil rights protection? So you need to have a physical or mental impairment that substantially limits one or more major life activities of such individual, a record of such impairment, or being regarded as having such an impairment. The ADA specifies that an impairment that substantially limits one major life event need not limit other major life events in order to be considered a disability. So that means, just because somebody functions well in one area doesn't mean they're not disabled. The broadened definition of disability also includes an impairment that's episodic or in remission, or transitory and expected to have a duration of 6 months or less. And that's kind of when we talk about short-term disability. So record of impairment refers to someone with a history of or who has been classified as having a mental or physical impairment that substantially limits one or more of the major life activities. And some of you might ask, like, well, how is it fair for an employer to hire someone who's disabled and then not have an employee that whole time? And the main piece of this is, if somebody's super qualified for their job and you don't hire someone based on the suspicion that they could have an impairment, that's technically, discrimination. Reasonable accommodation. So this refers to employers' responsibility to provide the necessary structure, reassignment, and equipment modification or devices, interpreters, or other reasonable needs that would allow the disabled person to perform the job satisfactorily. So, for example, somebody wants to be a teacher, but they have one arm, but they can still fulfill their job requirements. I mean, if you can't fulfill the job requirement, that's different, right? But if you can completely do the job, but you're being discriminated because you have one arm, or if you can fulfill the job requirement as long as you have the proper structure or equipment to do so, then that shouldn't preclude you from getting a job. So to qualify for reasonable accommodation, employers must identify essential job functions. So sometimes I get patients who come in wanting disability, or to get reasonable accommodations from their employer. And so here's the deal. So say you have like a really terrible neck injury, and so you can't lift everything over 5 pounds, but your job was working at Amazon as a packer. So like in the job description, you have to be able to lift 30 pounds. Well, then you can't be reasonably accommodated for the essential job functions. So you're not going to be able to work somewhere where that's the case, but you might qualify for disability, so that's the other piece too. The same goes for like if you're a pilot and then you lose your ability to see, well, for sure, it's not discriminatory hiring someone who's blind because they can't fly. So exclusions from the definition of disability: gender and sexuality identities, lesbian, gay, bisexual, transgender, transsexual, compulsive gambling, kleptomania, pyromania, illegal drug use, pedophilia, exhibitionism. Employers may hold alcoholics to the same performance standards as other employees, meaning that they're excluded. Provisions of the ADA is closely related to the Civil Rights Act of 1964, and there are 5 titles in the Act. So Title I prohibits employment discrimination. It's to ensure that people with disabilities are not excluded from job opportunities unless they are unqualified. Undue hardship is a provision an employer can make if the accommodation to be made for a disabled employee is extremely expensive or difficult to implement, and it affects public safety or health and safety defense, and in some circumstances, religious affiliation preference. Title II prohibits discrimination against disabled individuals by any state or local government entity without regard to respect of federal funds, and it also ensures access to public transportation by disabled persons. Title III prohibits discrimination by public accommodation against individuals on the basis of disability in the full and equal enjoyment of the entity. It mandates the removal of architectural structural barriers.